Departments in our area are struggling, and not directly because of COVID-19 cases or anything like that at the moment, but more the overall impact of the pandemic.
Amel Elhel spoke to hospital leaders from URMC and Rochester Regional Health to see how they're managing. She joins us now from the newsroom with more. Amel.
That's right, Adam. Teresa, those hospital leaders say while their emergency departments are being strained right now, it's not the worst it's been, but they are asking the community who have acute medical needs to avoid the hospital's emergency department if they can.
During the pandemic, hospital systems took in nursing home residents due to their own system being overwhelmed. Well over 2 years into the pandemic, a lot of those residents are still in hospital systems with nowhere to go, taking up space the hospital needs to function normally.
Our emergency room is doing a great job of caring for patients, but at any given time, and this morning, for example, we had more than 70 patients who were admitted, being seen by providers to admit to the hospital, but we're waiting for a bed in the hospital, and people can wait for hours down there.
Because of the overflow of nursing home residents, Strong Memorial Hospital's emergency department has nowhere to put their own patients, leading to backup in the ER.
By having so many patients in our emergency room, it makes it more difficult to care for the patients coming in.
Dr. Apostolakis says nursing home residents in hospitals aren't the only thing tying up resources. With over 100 COVID patients still in Strong's care, along with the national and local staffing shortage, the repercussions of the pandemic are still very much present. Meantime, Rochester Regional Health says they are experiencing these same issues, but they are issues they've been facing for years.
It is definitely challenging. We have quite a few patients that are waiting for hospital beds that have been admitted and waiting to get a bed in the hospital standpoint, which causes some challenges for our team and the challenge of taking care of that next incoming emergency department patient. But unfortunately, that's a phenomenon that we're seeing throughout the city.
Both hospital systems are encouraging community members with high acuity medical issues to come into their emergency department, saying they will find a spot for you. But if your medical need is something that can be taken care of through your primary care physician or an urgent care facility, they ask that you take that route instead. Teresa, back to you.
Okay, Amel, thank you. To help aid the incoming emergency cases, Rochester General has had a tent set up outside their building to take in more patients. That tent has been used since October of last year.